live. We're here.
I'm going to take you on the speaker. You're not the speaker.
Remind them to start getting their questions.
Yes. That's what I was,
Those
yeah.
are nice to have, like a
Yes,
rattlesnake
Yes,
shot.
we were talking about here.
afternoon, everyone. Welcome to the Houston SPCA, the campus for all animals. I am your host today, Dr. Roberta Westbrook, and I'm here to answer all of your questions about vaccinations in your canine pets. That's what we're going to be talking about. It can be so overwhelming when you are trying to figure out which vaccinations your pet needs, how frequently your pet needs those vaccinations. You're working with your family veterinarian trying to figure out which vaccinations are best, and I'm going to try to help you sort through some of those things today. But first, I want to say thank you for joining us. I want to encourage you to come on out to our campus this weekend. Bring your family, bring your friends, come take a look at all of the wonderful puppies and dogs and cats and kittens that we have up for adoption. They're looking for their forever homes. Please join us in helping us find forever homes for some of these pets. I want to introduce you to this cute guy here. This is Texan. Texan, how cute is he? He just came to us today and he's looking for his forever home. And so he is going to be our friend today. He needs to have a physical exam. He also needs to have vaccinations because we want to make sure that we protect his health. And so he's going to be our little volunteer today. Well, voluntold today because he probably wouldn't have volunteered to get these shots. But this is Texan. He's going to be available for adoption this weekend. He's going to get neutered and he should be available for adoption. So come on down and see us and join us. So get those questions together regarding vaccinations for your canine pets. And in the next week, we're going to talk about vaccinations for your feline pets. But today we're going to focus on the dogs, okay? So this is Texan. Again, Texan is about 10 weeks old right now, about 10 weeks old. And he is going to be a big boy. He's a husky mix, so cute. So when you are going to the veterinarian, you're seeing your family veterinarian, and it's time for your pet to get vaccines. Oftentimes you know this because maybe it's a new pet, or maybe you had a reminder from your family veterinarian telling you to come on into the clinic and get those vaccines updated. Usually when you bring your pet into the clinic, your veterinarian will start by making sure your pet is healthy enough for the vaccine. We want to make sure that your pet is bright and alert and active, doesn't have a fever, has normal heart and respiratory rate. Your veterinarian is going to do a full physical exam and make sure that your pet is healthy. And so Texan here has had a physical exam today. He's so cute. He's had his physical exam and he has been cleared to get vaccinations today. So we're going to demonstrate how that actually goes. In the meantime, though, I want you to, again, think of any questions that you have about vaccines, and we will try to help you work through those. There are some vaccines that are required, I want you to know, and there are some vaccines that are optional. And what I mean by optional is it depends on your pet's lifestyle, right? Not every dog needs every vaccine. Your veterinarian will work with you to come up with a vaccine protocol and schedule for your pet. It can be very individualized so that you don't feel like you are giving something unnecessary to your pet. We can work with you and figure out what is best. Now, I do want to point out the one required vaccination. It's required by law, and that is the rabies vaccination. So the rabies vaccination is the one vaccination that is required by law, and it needs to be given between the ages of 12 weeks and about 16 weeks. So your pet needs to be vaccinated by rabies by the time he or she is 4 months old, about 16 weeks old, but not before 12 weeks old. So as I mentioned, Texan here is just 10 weeks. So we're not going to give Texan a rabies vaccine today, but the rabies vaccine is something that's required by law, and it helps to prevent vaccine spread, not only in the animal world, but to humans as well. You all may realize that rabies can be transmitted to people. And so we want to make sure we protect the public as well. And so that's the rabies vaccine, which we won't be giving to Texan today. So before we get started with Texan's vaccines, does anybody have any questions about vaccines for your pet?
We do. We have one question from Stacy. So Stacy is asking, how often do pets need to be vaccinated? Annually, more than once a year?
What a great question. How frequently? And it's going to differ a little bit. So if you have a young puppy like Texan, we give vaccines more frequently. And you might say, why is that? They're so little, they're so young. Why do they need more frequent vaccines? Well, initially, your puppy, if they have been nursing with their mom, they will get what we call antibodies. Antibodies are molecules that fight off disease, and they will get antibodies from their mother when they're nursing through the milk, through the colostrum. But eventually those antibodies wane. And so we need Texan to develop his own immune response. We need him to develop his own immune response to fight disease. And so what we do is we give vaccines that won't cause the disease, but that will stimulate his immune system to form more antibodies. And that can happen over a period of time. So sometimes it may take 2 or 3 boosters of vaccines to get the type of immune response that we need. So if you have a young puppy, those vaccine frequencies are probably going to be about every 3 to 4 weeks for 3 or 4 vaccinations. Once your pet is an adult and their immune system is very mature, then we move to every year vaccines. So usually those vaccines are less frequent and approximately every year. But if you have a puppy, don't be concerned. We do need to have those vaccines boosted so we can make sure that their immune system is stimulated appropriately. Great question.
So we have another question from Jamie who wants to know if there's anything besides rabies that's legally required. And I'll add a follow-up to that. Are there required vaccines for boarding animals?
Great. So when I say required, I think it's good that I clarify. So legally required means that each state will create the mandate for which vaccines are legally required. And rabies is the only one. And that's because of its public health concern. It's a public health concern. Rabies is a disease that is fatal. And because it can be transmissible to people, states create laws that say we have to protect the public against those infectious diseases. And so rabies is the only one required by law. Now, you might hear certain vaccines be required by boarding facilities or grooming facilities, or to travel. Those required vaccines are in order to prevent disease spread. They're not required by law, but they may be required by the facility who's going to be housing your pet. And that's to prevent disease spread. We don't want these little cuties to get sick. We don't want them to get diseases like distemper or parvo or kennel cough. And so we may say that they're required, and that's just to prevent the disease spread. So good clarification that when I say required, it doesn't necessarily mean by law. It means that wherever your pet is going to be, boarding, grooming, that they may have specific requirements to prevent disease spread in their facility. Great question.
I think that's it for now. We'll have a couple more questions in a few minutes after
Fabulous.
Hudson's treatment.
Fabulous. So Texan is going to get today one of what we call the core vaccines for dogs. And what I mean by core vaccine is something that we strongly believe in the veterinary profession that all dogs should get. It's going to protect them against the most common infectious diseases that can, in some cases, be fatal. And this core vaccine is the vaccine that most boarding and grooming facilities are going to require. And it covers about 5 different diseases. And you may hear it abbreviated as distemper parvo. You may hear people call it DA2 PPV. You may hear people call it DHPP. There are so many abbreviations in the medical field. Don't worry, your veterinarian and the staff will help you sort through that. But basically, the most common diseases that people are most familiar with are parvovirus and distemper virus. But this also prevents several other respiratory viruses as well. So Texan needs that vaccine today. And we are going to see how brave Texan is to get these vaccines. So if you have a puppy and you just got this puppy, it's just like having a little child, right? You take them to the doctor for the first time and they're getting a shot and everybody's nervous. It's important to keep things lighthearted, to keep things calm so that they don't react too negatively to the shot. But it is a poke into the skin. And so some dogs don't like that, but we're going to show you how brave Texan is. So what we do is we're going to draw up these vaccinations. And these vaccinations are usually just given in the subcutaneous space of the skin. So it's just right underneath the skin. And usually they tolerate it really well, particularly if they have a treat or something to focus on. So we're gonna try to distract Texan here, get him all. Get him all ready, okay?
He's being so good.
He's being very, very good. Do you have a treat, Texan? Do you want a treat? And veterinarians usually have locations in the body that they commonly administer these vaccines into. And so we will oftentimes use the shoulder area or the rear leg area. And those are just common locations so that we can all sort of be on the same page. So what I'm going to do is I'm going to administer this vaccine in Texan's right shoulder here, and it's just under the skin. So what we usually do is we just tint the skin and we say, little pokey. Oh, wow, how brave. He didn't even cry. He didn't even move. And I can certainly take credit for that and say it's my wonderful shot giving skills. I really think it's the Hills Pet Nutrition treats that we gave, but I'm not a bad shot giver either. So that's one core vaccine that Texan is protected against. We want to protect him from getting parvovirus, distemper virus, parainfluenza, hepatitis. We want to prevent those, okay? So the other vaccine that you guys are probably very, very, you're very familiar with is kennel cough. You probably have heard that. If you have ever taken your pet to board or groom, you may have heard that you need the kennel cough vaccine. Well, that vaccine can be given a variety of ways. We have a formulation in which it's given in the nose. And the reason it's given in the nose is because that's one of the routes of infection for kennel cough. It's a respiratory virus and bacteria. And so it can get into your pet through the nose. And so one of the ways that the vaccine companies have tried to combat that is to actually give a vaccine that's effective right at the site of infection. Okay, so we're going to draw that up. While I get that vaccine drawn up, what other questions do you have about vaccines?
So I have a question from Beth. Beth wants to know, is it possible to get a vaccine waiver if your dog never leaves the yard? And then she's specifically asking about the rabies vaccine. It has given her dog seizures in the past.
Oh, interesting. So, if your dog, I'm less familiar with the vaccine waiver, but if you're wanting to decrease the amount of vaccines that your pet gives, talk to your veterinarian about having a test done to check your dog's vaccine titers. So titers refer to the amount of antibodies present in your pet that might already be protective. And so it is possible for you to get a test done to see whether or not your pet has adequate levels of antibodies that are currently protective. It can be somewhat controversial because there's no definitive level of antibodies that can guarantee protection. So generally, we still recommend at least every year vaccinations. But in some cases, when animals are older, or they're certainly indoors, not exposed to any other pets, that your veterinarian can kind of make that decision with you about whether or not your pet needs to continue with annual vaccinations. If your pet is having a vaccine reaction, you mentioned that every time your pet gets a rabies vaccine, it has a seizure. If your pet is having vaccine reactions, there are sometimes different companies that you can use and different formulations. I would talk to your family veterinarian about the particular type of rabies vaccine and if there are alternatives, but it does tend to be something that's required by law. And so I would talk to your family veterinarian about how you can do that safely and still maintain maintain your legal status in good standing. Okay, so now what we have is this intranasal vaccine. You can imagine that putting this in the nose is not going to be the most comfortable thing, but animals tolerate it really well. And again, if you're at your veterinary clinic and they're having to give a vaccine in the nose, just be good moral support for your pet. Hang in there, and we'll see how well Texan does, okay? So usually we just kind of, hi, Texan. We're going to just be very gentle, and we're going to try to be very quick, and we're going to hold his nose up toward the ceiling.
Oh, good boy.
Good Wow.
Job, Texas.
Well, I just don't know a better patient than Texas. He gets an award today. I'm not kidding. You get an award for the best 10-week-old puppy. Yes, you do. Okay, so for now, Texan is all current on his vaccines, but he's just 10 weeks. He's going to need these vaccines boosted because we want to make sure that we are making sure that his own immune system generates an adequate response to fight off these diseases should he ever come into contact with them naturally. So what we're trying to do is we're trying to get his immune system hypersensitive and ready so that when it encounters these diseases in nature, his immune system will be ready. They'll say, oh, I've seen that bacteria before. I've seen that virus before. We're ready to fight it and we're good to go. But that sometimes takes a couple boosters. What other questions do you have?
So Shayna missed the beginning of our discussion and wanted to know the rabies vaccine frequency. So if you could confirm how often a pet needs to get their rabies vaccine.
No problem. You didn't miss anything because I didn't specifically address the rabies vaccine frequency because rabies is different from the distemper parvo combo that I did mention. Rabies is just given one time between the ages of 12 weeks and 16 weeks. It is then boosted 1 year later. So rabies is a vaccine that does not need to be boosted until a year after the initial one. And then following that booster, your pet is eligible for getting the rabies vaccine every 3 years. So talk to your family veterinarian about the schedule that your pet needs. But in general, in the state of Texas, you give the initial rabies vaccine between 12 and 16 weeks. That does need to be boosted a year later. After that, your pet can go to getting that rabies vaccine approximately every 3 years. That's different than the distemper parvo combo. Those diseases are much more frequent in the environment, and those vaccines we still recommend every year. Good question. What else?
So Jamie has a question. It's going to be a two-parter, then I'm going to add one. Her question is, what happens if my pet has a reaction? And then I'm going to add the part, do pets have the same kind of reactions that sometimes children do to vaccines? Do they get tired, and can we expect anything like that?
Perfect question. You guys are all over it. So yes, pets can get vaccine reactions. So the way that we like to describe vaccine reactions in pets is that there are some commonly expected reactions, just like you mentioned, being tired for the day. But that's about it. It should be very mild, maybe a little tired for the day. That's not uncommon, and what we would consider within normal limits. What is not within normal limits is if your pet receives vaccines and your pet has adverse reactions that might include, but aren't limited to, vomiting or collapse where they're unresponsive, or swelling. Sometimes they get itchy and they have an immune reaction to the vaccine and their face swells up. They get very itchy. Those would be signs that your pet is having an adverse reaction, and you should get your pet back to your veterinarian right away. Call your veterinarian, but get in the car and head right away. There are treatments that we can give to help mitigate those reactions and keep your pet healthy. But absolutely, they can get vaccine reactions. It's not every pet, and sometimes there's no way to tell before that first time. So once you know that first time that they have those vaccine reactions, in the future, now your family veterinarian is aware of it and they can take proper precautions to prevent it in the future.
So the other questions that we have are starting to relate to cats, and I know we're going to talk about those next week. So do you want to tease a little bit of what we're talking about with cats next week?
Sure.
There's one person that specifically is asking about indoor cats versus an outdoor indoor cat. So
yes, absolutely. And we are going to talk about, I guess what I will say is, we are starting to really tailor our vaccine protocols for your pet's lifestyle. And so the vaccines that are going to be necessary for an indoor only pet that is not going to have any exposure to any other animals may be different than the pet that's very social, that's going to be indoor and outdoor, the one that's going to be at the boarding facility or grooming facility or traveling. And so you're right to bring up the fact that you have a cat that stays inside all the time. And is it, and which vaccines are necessary? I would say, again, talk to your family veterinarian and come up with a protocol that's good for your cat, because certainly some of those vaccines for infectious diseases over time may not be necessary to give us frequently.
So we have one last question. What happens if your pet misses a vaccine for a year or a period when they're supposed to have it done?
Yes, that's a good question, because sometimes that happens. You may be a couple of months late, or you might miss an entire year, and that happens. I would say as your pet ages, usually the immune system is what we call competent. The immune system is strong. And so if you miss a year or so, it usually isn't going to be as negative of an interaction as if your pet is young. So I would be much more concerned if your pet is less than a year. Don't miss those initial series of vaccines. As your pet ages, you can talk to your veterinarian about the frequency. They may say that your pet doesn't have to get vaccinated every year. Those immune systems are competent, they're strong. And so you don't have to start the vaccine series over. If that's what you're concerned about, like if I miss a year, do I have to start the whole series over? No, you don't. You kind of just pick up where you left off, essentially. So even if you skipped a year, pick up where you left off. Your veterinarian will tell you how frequently to get those vaccines in the future. Look at little Texan. He did so good. You did so good. Say hi to the people. Look at that ear. Say hi to the people. Show them how good you are. Tell them you're going to be looking for your home soon. So you guys come on down to the Campus for All Animals. If you'd like to help us save more animals through our 24-hour rescue ambulance, through preventing cruelty to animals, to helping pets like Texan get rehomed. If you want to partner with us, please go to HoustonSPCA.org/donate and become part of our family. Thank you so much for joining us. It's always a pleasure to talk to you guys. Thank you for your questions. Bye. Say bye, Texan. Thank you so much.